I'm going to ask a couple of questions here in a moment about the achieving better care by monitoring all prescriptions, also known as ABC MAP. And this may fall in the category of validation for the legislature. I think we all felt on this side of the table pretty good about passing that legislation. So here goes. I'm wondering if the implementation of the database has impacted any patterns in physician prescripting.
Thank you for that question. So as I was mentioning, there are three pillars, and prevention is the first one. And the Prescription Drug Monitoring Program, or the ABC MAP program, is really one of the linchpins of the prevention effort. So we implemented the Prescription Drug Monitoring Program in August of 2016. And in that time, we have made significant progress in terms of decreasing both doctor shopping as well as decreasing the rate of opioid prescriptions. Since the beginning of the program, there are over 90,000 registered users, prescribers, and dispensers. They conduct 1.6 million patient searches per month. We have virtually eliminated doctor shopping in Pennsylvania with this program, and we have decreased the number of all opioid prescriptions over 21%. Go ahead.
I was just going to add or ask, is the implementation working across state borders as well?
Yes, it is. So some new programs that we have for the ABC MAP program. One is that we are part of a collaborative, so it interacts with 19 different states, all the contiguous states and other states in the country. In addition, we've worked with a grant from the CDC to integrate the Prescription Drug Monitoring Program into many of the electronic medical records that health systems and hospitals use. We also are working on what's called academic detailing, where we have a grant from the CDC where people will go out to doctors' offices to talk about using opioids more carefully and judiciously. And we're actually starting a new program called a patient advocate program, so that if patients feel that they cannot not get medicines that they need, that they're going to have a phone number to call where we'll help them navigate that system. So the ABC MAP program has been an overwhelming success, and thank you so much for that legislation.
You're welcome. Can this then be extended into the Medicare managed care organization arrangement? Do you think it will save us money?
So PACE is part of the Prescription Drug Monitoring Program. Means any physician that prescribes any opioid or another medicine, benzodiazepines, has to check the system every time they write that prescription. And any pharmacist who is dispensing any of those controlled substances has to check the system and also input, of course, that dispensation.
On your wish list, is there anything that we should consider to improve the program?
The ABC MAP program? No. The ABC MAP program is running extremely well.
Excellent. Last question. The MAP Act apparently requires people in need of addiction treatment to be identified and provided with treatment. How many individuals would you say have been given or recommended for additional treatment?
So that doesn't happen through the ABC MAP program as much as other programs that Secretary Smith might administer.
Yeah, so that referral for treatment can happen in a number of different ways, particularly when you're talking about the Prescription Drug Monitoring Program. One of the grants that we've received from the federal government and been implementing, and I can get the statistics here for you in a second, is called an SBIRT grant, which stands for Screening, Brief Intervention, and Referral to Treatment. And this is an opportunity for individuals seeking care at, for example, their primary care physician's office to be given a brief screening, and if in fact it appears that they meet certain risk factors, they would be referred for treatment services. In terms of referrals to treatment outside of primary care physician offices, those referrals can happen really from any healthcare source, and the assessments then would be done by our single county authorities. They could be done by treatment providers in a myriad of different ways. So if you're looking for some specific data about how many individuals we treat per year, I'd be happy to send that information to you if you're interested.
I am, and thank you very much,
Sure.
all of you. Thank you, Mr. Chairman.